Welcome to the Miller Chiropractic Minute. Today we're going to discuss riding through back pain. As some of you know, I am a triathlete, and I asked this question on Twitter. I said, who has something they want to talk about? And so one of the Twitter followers said, riding through back pain. She also mentioned that as she was riding, it was a relatively long ride, and she got pain on the side. So that's also actually flank pain. A couple things you'd really have to be careful with there is, first off, flank pain could be kidney, could be having a urinary tract problem, just coming out of the holidays and everything else like that with lots and lots of sugar. You really got to worry about that. But otherwise, let's discuss some of the things that cause back pain. When we look at a model, the nerves come out of the intervertebral foramen, and there are a lot of different things that can pinch on the nerves. If you look at it this way, inside there is the nucleus propulsus, outside is the annulus fibrosus. That's kind of hard to do there. When you look at the annulus fibrosus out here, it's very tough, and there's no nervous innervation until you get to the very last outside piece, and then that's highly innervated with nerves. And being so highly innervated with nerves, once the disc starts to bulge into that, that causes a lot of pain, and that can come out here and hurt the nerve root. So my first question would be, some telltale signs that it's a disc. Wake up in the morning and you have stiffness and pain. Takes 10 to 15 minutes to get going. After you get going, then it eases up and you can go on and you're doing all right. The other thing is if you sit down for a little bit of time and then when you get back up, you're stiff. Do you get up and you're leaning to the side? That's called an antalgic posture. When you sneeze or cough or push when you're going to the restroom, do those things give you issues? If so, that is a sign of a disc, and it probably needs adjusted and or decompressed. You can also use acupuncture on that. Massage therapy helps alleviate the muscles. There's a bunch of things that you really have to take into consideration. Now, for triathlon specific, and talking about the bike, you have to look at the spine and the way the spine is made. There's a normal lordosis in the lumbar spine, so this curve kind of represents what's normally supposed to be there. When you are on a bike, you flex the hips and then you lean forward. Okay, when you do that, it flattens out the lumbar spine. As it flattens out the lumbar spine, you're putting pressure right here on the anterior portion of the disc. And if you see this piece right here, that's kind of showing you how a disc bulge will come out. As this squishes, it's like jelly out of a jelly donut that starts to squirt out, and that will cause an issue. So you need a properly fitting bike. We did the retool method, and it seems to do all right. I still do a little tweaking with that because from what I've seen with those, it's meant to put you in the perfect position. And the problem with the perfect position is not necessarily a comfortable position. Even Lance Armstrong doesn't ride, and he's not the best in the world, but if you talk to any cyclist and do any reading, and most of the stuff that I've read is on Lance Armstrong, when you look at his perfect position, the thing with his perfect position is he can't stay aero. He broke his back a while ago, and so they actually have to move it, and he gets more wattage, more power when he's more comfortable. Not in the perfect position, more comfortable. And so that's the same thing with us, and I need to actually have my bike refit because when I did it, I was 30 pounds heavier than I am now, and I've lost that gut. And so I can actually move around a little more. So I would say to get the bike properly fit, check and make sure it's not the disc. Maybe you have a strain. One thing you can do if it's strained muscles is, let's think of these as your legs. If you lay on your back, bring your legs up, put them in a chair, and keep your legs at 90 degrees, that will start to unlock the psoas muscle. And as it unlocks the psoas muscle, the back pain will slowly ease up. So I do highly recommend yoga, stretching, strengthening exercises, full body workout, work on the core, because you have to have a strong core to bike. You have to have a strong core to run. You have to have a strong core to swim. And all of those things are very, very important in protecting your back too. A strong core will protect the back. One last thing, and I always have to mention this with any type of injury, is if you have a pro-inflammatory diet, if you're eating if you're drinking sodas, if you're eating refined sugars, if you are doing things like that, highly processed foods, even all natural food that is processed and in a package has preservatives in it, and you have to be careful of the preservatives. Those things will make you pro-inflammatory, and if you're pro-inflammatory, you are more predisposed to being injured. Let me see if I hit everything. Forward flexion of the spine, placement and posture, bike fit. If you have pain off the bike, that really should be taken care of. You should have it x-rayed and have it looked at, and make sure that it's not something that's a little more insidious rather than just muscles. If that doesn't answer your questions, feel free to email me, indianabackdoc@gmail.com. I will be happy to answer any questions, or hit me up on Twitter and I am @indianabackdoc. Thank you and have a great day.